My name is Jeffrey Boschman, and my master's research involves making deep learning models for ovarian cancer diagnosis more reliable with color normalization. We all make a lot of decisions every day. For many of us, these are about things like what food to eat or what path to take, but some people, like doctors, make decisions that can be life or death, especially when it comes to diagnosing diseases. However, when it comes to ovarian cancer, this is not so easy. Historically, ovarian cancer has been treated like a single disease, but in fact there are 5 major subtypes. Diagnosis of these subtypes is currently done by pathologists looking at what are called H&E slides. Getting diagnosis correct really matters because the subtypes truly are distinct diseases with different characteristics and treatments. For example, a subtype called high-grade serous carcinoma has an 80% response rate to chemotherapy, but another subtype, clear cell carcinoma, only has a 15% response rate to this treatment. Unfortunately, most pathologists do not have the specialist training required in order to diagnose the subtypes well, and this is part of the reason why ovarian cancer is the most deadly cancer of the female reproductive system in North America. Therefore, my research is about making a deep learning model to help pathologists diagnose ovarian cancer subtypes more effectively. One major obstacle is that the color of H&E slides can vary greatly. Although human pathologists can adapt to these color differences, this really affects computer-aided diagnostic systems. Many color normalization methods have been developed over the past 20 years, but their generalized utility for deep learning hasn't been studied enough. So, we did a comprehensive study comparing various methods. We found that color normalization does not consistently improve diagnostic performance when training test data are from the same center. Looking at the 3 box plots, which are from 3 datasets of different cancer types, the x-axis has the different color normalization methods, where the blue on the left is with no normalization, and the y-axis is AUC results from multiple cross-validation splits and reference images. We found that no method is consistently the best across the datasets, and as well, the cross-validation split and reference image chosen often made a huge impact on the exact result. However, when training test data are from different centers, color normalization does improve results. Moreover, we found that by mixing patches from multiple methods and reference images, we can consistently get results to outperform most of the singular methods. The rationale behind this is that if there is not one normalization method or reference image that is ideal for all datasets and tasks, training a model with normalized images from multiple methods and references should make it more robust. Now, when we use this mixed color normalization strategy, we can immediately see improved results from the ovarian cancer classifier. The next steps are things like training with more diverse data, modifying the model, and hyperparameter tuning. The goal is a robust enough model for clinical practice to supplement pathologists. For example, it can be used to increase the accuracy of diagnoses by general pathologists and alleviate the workload of the specialist pathologists, such as by providing a second opinion or classifying the obvious cases so they can focus on the more complex ones. Thus, it will allow more patients with ovarian cancer to be treated earlier and more effectively, and accordingly reduce the deadliness of this disease.